Evening and welcome to the February 17th meeting of the Oakland Community Health Network Board. We welcome you here this evening. At this time, if you can, please rise and we will do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God. Would you do the roll call, please?
Mr. Young?
Here.
Mr. Furman?
Present.
Dr. Giles? Here. Pastor Jones?
Present.
Dr. Guadalupe? Here. Ms. Woodruff?
Here.
Dr. Hans?
Here.
Dr. Krenchuk?
Present.
Mr. Smith? Ms. Root? Here. Mr. Cowan?
Present.
You have quorum.
Thank you. At this time, I would ask for an approval of tonight's board meeting agenda as printed.
So moved. Support.
Motion and support. Any discussion? No changes? All those in favor say aye.
Aye.
All those opposed, the motion carries. At this time, we have opportunity for public comment. We would ask that when you come to the podium, first we'll make sure that the microphone is on, and we would ask that you state your name, and if you want to disclose any affiliation with an organization or representation of some kind, you're free to do so, but it's not mandatory. We would ask that you address the board, not any individuals on the board, and also that if you would limit your comments to 3 minutes. So at this time, we did have two individuals who signed in for public comment, so I'm going to call them first, and then we'll go to anybody who may be online or otherwise in the audience this evening. So first we have Mary Ann Huff.
Thank you.
Yes. Yeah. Is it red?
There we go.
There it is.
I found it.
Kind of like hockey. The red light goes on, and you know.
Thank you so much. Good evening, everybody. My name is Mary Ann Huff, and I am the president and CEO of the Mental Health Association of Michigan. You have a statement that my board issued regarding the transition of crisis services in Oakland County and its concerns, but I'm here to make some additional comments related to that. I also want to add that by way of history, I worked for Oakland County Community Mental Health in the 90s as a case manager working with adults with serious mental illness. I had a brother who was in your system for 11 years who was served very well by TTI, and I was his guardian. And I just wanted to make sure I mentioned that. So been on a lot of sides of the system. I'm also a former CMH director. So MHAM's been around since 1936, and we are a policy organization. And our main goal is to make sure that anybody who has a mental health condition or substance use disorder in this state has access to quality services, and that they're able to access those services easily and effortlessly and without a lot of hassle. I do a lot of advocacy in this state. I have for over 20-some years. I used to work for Disability Rights Michigan, and I will tell you that the system we had 30 years ago is not the same as system that we have today. Things have not gone in the right direction. Concerned about what's going on with Common Ground. I remember taking people to Common Ground when I was a case manager. That was 30-some years ago. And despite the fact that the September board meeting minutes say that OCHN is moving toward a crisis continuum of care that includes enhancing service delivery, expanding service utilization, and collaboration and continuous improvement, on its face, it looks like the decision on the part of OCHN to return to direct operations of crisis services was perhaps made based more on the fact that at the time, the Michigan Department of Health and Human Services had an RFP that would have procured the PIHPs, which would have meant that OCHN would no longer be able to be both PIHP and CMH. So it would have had to reestablish itself as a CMH. And if you look at the Mental Health Code in Chapter 2 of the Code, MCL 330.1206, There's about 8 different core things that CMHs are supposed to do. One of those things is crisis services. I'm not here today to question whether or not OCHN can or cannot directly run its own crisis services, because you are actually statutorily required to provide those crisis services. The question is whether it should run those crisis services that it has not direct operated in over 35 years. In other words, to dismantle a program that has become a community staple for over 30 years in just a few months under the guise of ensuring a continuum of care seems both dangerous and disingenuous. Common ground has been interwoven in the fabric of the community, and frankly, if it's not broke, why fix it? People who are in crisis benefit from having basically what I consider to be a mini emergency room, and they have a lot of people that have been there for a very long time. The other thing I want to say is that we're concerned about the chilling effect that this has on people who contract with CMHs and PIHPs across the state. When they look at the dynamics, of course, we see what we see. I participated in a couple of your board meetings. We don't know all the details, but on its face, it looks like OCHN doesn't treat its network providers very well. And when you think about the fact that it's the network providers that provide the services that CMHs frankly can't afford to provide because their costs are too high. They can't bill insurance. And a lot of times when there's a budget problem, the cost is shifted down to, or actually the budget reduction lands on the back of providers because they often find their rates of reimbursement cut significantly, hence one of the reasons why we had the KB versus Lion suit. And it doesn't just happen here. That happens across the state. I've seen it happen a lot.
Could I ask you to
Sure,
wrap up?
absolutely.
Yeah. I've been generous.
No, you've been. So that's all I wanted to
Okay.
say. I appreciate the opportunity to bring these concerns to your attention. Thank you.
Thank you. The second person who signed up, and I believe it's Nora. Is it Nora? Is it Bigelow? Or I'm sorry.
Valerian.
Huh?
Valerian.
I apologize. I can't read like I used to. So go ahead.
I've been a consumer with CMH for about 35 years, and I'm a member of the Mental Health Association of Michigan Board. When I heard about this, that there was problems with CMH and OCHN and Common Ground. Common Ground is crucial to the people that have mental illness. When people go there, there's housing, there's beds available, and when people call in and go there, there's counselors that talk to them, the crisis line. And yesterday, during my meeting that I lead, someone was in crisis. And it's the first time that I could not give them the phone number to Common Ground. Now, Common Ground, like I said, is very, very crucial to the person with mental illness. Without Common Ground, how are people going to do a warm line? Who are people going to call and get better? Thank you. Any questions?
Yeah. We're all set.
Questions?
No. Okay. What we'll do now is we'll switch and follow our, we had the two individuals have spoken who signed in, and we thank them for their comments. And then do we have anyone online?
If you are online and wish to speak for public comment, please raise your hand at this time.
Okay, thank you. Is there anyone else in the audience who wishes to address the board this evening? There being no one else, I will close the initial public comment. We do have an opportunity for public comment towards the end of the meeting also. So at this time, I think I'll call Suzanne up for our stories that inspire hope, and someone many of us have met before, and that is Officer Amy Dreimer. If you could also come forward.
Good evening, everyone. It is my pleasure to do the Stories That Inspire Hope this month. As you may remember, we held our Law Enforcement Appreciation Breakfast last month, and obviously we honored a number of individuals for our CIT awards, but I am really pleased to have Officer Amy Dreimer here. She is our CIT First Responder Award recipient. She is also the Stony Creek High School Resource Officer. I'm going to let her tell most of her story. I'm just going to say a few things. She's 25 years as a law enforcement officer, 18 of that with the Rochester Hills community. So that's pretty amazing. She's bringing some great resources to that community, including, it sounds like she just goes above and beyond. I'm telling you, the write-up about her was just phenomenal. She goes above and beyond for the students and that community, ensuring that there's clothing drives, food pantries, bikes for students to get to school. So I just wanted to highlight a couple things to make sure that she touches on those types of things and talks about some of the great things she's been doing. But she also plays an essential role with CIT in the community, ensuring that the team gets those trainings and things like that they need in that community. So with that, I'm going to turn it over to Amy to talk to you about a day in the life with Amy, the Officer Dreimer.
Well, thank you. No pressure, right? But thank you, first of all, for the honor. That was a surprise, and I appreciate it. Just some of my background. I'm with the City of Rochester Police Department. Been there 26 years. Just because, you're getting close, you got to count every year. And I've been with the schools for 18 years now as a school resource officer. I started in the elementary level. In Rochester Community Schools, our program is very unique. It's not like most school resource officers where we just respond to problems. We teach actually an educational portion in every grade level. So we have school resource officers all the way from K to 12. So in the elementary level, we're teaching stranger danger, bullying, good touch, bad touch, and getting out there and interacting with kids. And then obviously any crime-related thing that might happen in the schools. A lot of elementary school is abuse. We follow up on CPS reports. And in the high school level, then I moved on to there, and I've been there for 15 years now in the high school level. So I have a middle school, a high school, and an alternative high school. Even getting into the schools, and one of the reasons I wanted to get in the schools was I found out on the road that you would respond to calls and you would clear those calls out, and really there wasn't that opportunity for a lot of follow-up, to follow cases along, to make sure that you weren't responding to the same calls over and over. And being able to go into the schools, I'm able to follow kids all the way through, build those relationships, not only with the students but their families, and see what supports they might need. It's difficult too with juveniles. I know your board, you guys handle everything, but for us with juveniles and mental health, it's very difficult. And as police officers, the system is very frustrating. And I found even on the road that it was easier just to take a kid to the ER and be done with it than to have to follow and figure out, navigate the mental health system. And we see that in law enforcement today still. Luckily, the CORE program, I think, has really been integrated into the system to help law enforcement officers navigate that. Because I found, even coming into the schools and dealing with a lot of mental health cases in juveniles, it was frustrating for me. I would take, we found that when you would take a juvenile to the ER, you'd get families frustrated with you because their child needed mental health, and they'd go there and be treated like they were sick, put in a gown, blood drawn, all this stuff, rather than not just focusing on the mental health piece. and then I'd find 2 months later that same juvenile needed some more mental health services, and the families would be so upset because they just spent 2 days in an ER, couldn't leave, and didn't get the help that they needed. That I wanted to learn and navigate the mental health system so I could better prepare and help those families and the officers on the road. And I found myself, when I first got into this, it was frustrating. You know, I'd be told something at the ER this week, and next week I'd go back and they'd tell me something different. And the same thing with Common Ground. I can't tell you how many times I would take a juvenile to Common Ground and they'd say, we can't take you, you have insurance. And it was like, whoa, but it's we need to get in here, we need these resources. Going to the ER is not beneficial for this family. Maybe somebody didn't have transportation, and every week I would get different responses. So kind of learning to navigate that and being able to help the families as a police officer, because we have to be real. If it's difficult for me and I'm not the one with the mental health crisis or the child with the mental health crisis, as a parent to then try to navigate that was difficult. And sometimes there is that lack of education too, and just that frustration that being a police officer, I realized that I needed to be able to help with that process and educating myself on that to help them. And that's where we go back to CORE. I don't know if this is how you guys wanted me to talk about this.
No, please, no.
CORE was able to come in and help navigate that too. Where I might not be there to help that navigation. If CORE might not be on duty, the officers have now learned, okay, this is what CORE would do. They would call the Youth and Family Care Connection, or in this case, because it's an imminent, maybe there's a plan, they do have to go to the ER. Well, there's no plan, but they're having suicidal ideations, so we could call the hotline. Or we can provide them with some resources. That's something else that we started in our district at my school, was we found that we'd have these families and we say, your child's having suicidal ideations, you have to get help. But then we would leave them hanging. And I'd find myself writing down names and numbers and sheets of paper to give to families, so they would go home and have this written down, where at our school we created a list of, here's all these, resources. Here's 24/7 resources. Here's, behavioral health, during the week if you need to call somebody, so that we would hand them with a packet, with maps, with everything, so that family, that caregiver, as that can be overwhelming for somebody to find out their kid's having suicidal ideations. There's no thinking like, what did they just say to me? What did the school say to me? What did that officer say to me? Here it is in a packet. You got it all there. So if you're stressed out, you can just reference that and go back and see what you need to do. So I think what I'm saying is, the learning and your programs and just the mental health piece, it's tough to navigate. I mean, you guys all know that, and especially for us to try to learn to navigate the ins and outs and the changing every day. It takes some work, and it can be frustrating, and it's work in progress.
Does any member of the board have any questions for our officer?
Tell you, thank you, Amy. I listened intently. First thing, thank you for sticking with it, okay? Because, how many doors close before people just give up? And the idea that you took that extra time to follow up, and then not only to do that, but to create some form or system that would alleviate some of the steps. So I compliment you on that. I thank you very much, because there's a lot of people out there that are frustrated, and it doesn't take too much. When a person's going through something, the most important thing is, how do I get help? And then for you to recommend 2 other places, 2 other steps, that's not what they want to hear. So yeah. I appreciate your story. And hopefully we will be able, Suzanne, to spread that, to others. if, even as we meet, to see, okay, here's some steps, and now we have a person who can say, I have a solution. So I appreciate you.
Thank you.
Yes. Sarah?
Excuse me. Yeah, no, I just want to say thank you for all of the service that you do for the City of Rochester and Rochester schools. I think it's extra important in times like this where there are such positive relationships between law enforcement and families and juveniles, and I think what we've heard about your story and just from what you've shared, that you really make that connection with the families, where sometimes we don't always see that, and I think that really helps with that, just that foundation of building relationships that many people don't get with law enforcement. So
Yeah,
thank you for that.
Thank you.
Yes. Dr.
Also wanted to say thank you. As I heard you talk about your triage of sorts, I work as a psychiatrist, so often I get that youth in my office saying, they said I can't go back to school until you evaluate me and you clear me. And it's like, wow, how do you clear years of trauma, experiences that have led to this point of suicidal ideation? So I was excited to hear that you all do triage and say, okay, well, this person may need to go to the emergency because we're looking at a hospital visit. Otherwise, here are some more resources. So again, thank you, because I'm sure when you started many years ago, 26 years ago, you weren't thinking mental health is where I want to be. But it sounds like somehow you navigated there and you're doing a really good job. So thank you for your service.
Well, thank you. But I think in law enforcement, we see the majority of what we deal with, right, is mental health. And if we can try to get to the bottom of it, we don't keep responding to the same calls, right? The ultimate goal is to get that person help, so we aren't needed anymore in the law enforcement community, right? At the end of the day, it's to get people help that they need. And if we can help out, that's great.
But can I add, because you made a statement about some of the frustration that the officers go through because you can't do, and I know we have co-responders or co-responders, and I tell you what, a lot of times we don't consider the anxiety or the frustration that the officers go through because they can't find a solution. They want to help. And so I think it's good, for us to hear from you that here's some of the frustration we go through, and maybe that's something as we meet with our officers and talk with them, again, to talk about their level of frustration. That's very, very important. And I raised that because a couple of years ago in the city of Pontiac, where I pastor, we had a couple of incidents. Well, a lady and her kids froze, and officers were doing everything that they could, but there was a level of frustration in relation to where they were going, trying to get help, and blah, blah, blah. So, sometimes an incident happens and then it's like pushed away, but it's good for us to resurface those and say, what else can we do? How can we help? And that's why I tell you today, thank you. Thank you for what you've done. Thank you for the tenacity that you had, and thank you for showing us, again, hey, we get frustrated, but we're still trying, so thank you.
Well, I think there needs to be that consistency, too, because I can tell you with my experience, it wasn't even that long ago when New Oakland, well, maybe 5 years ago, New Oakland had come out with the mobile crisis unit, and I had posted a flyer at the station, and I tried to educate the guys about, again, the difference between ER, need help now, versus the assessment and, long-term help. And I was pushing the New Oakland, had posted the flyer, had educated the guys about it. And one morning I come in and they're like, well, we called New Oakland last night. They said, no, we had to take the kid to the ER. Well, did they have a plan? No. Well, what was going on? Well, they had just talked about, kind of feeling hopeless and really wanted to talk to somebody. But New Oakland said we had to go to the ER. So it was like, here I'm trying to get the officers to look at the big picture of things. They did what we're trying to tell them to do, and then they get frustrated because they utilize that and they get shot down. So what happens now? We get set back where now we're just going to the ER. It's so much easier. We just go to the ER. We go to the ER. And you guys know that the ER isn't always the best place for a mental health crisis.
Right. First, I want to say that as I heard you speak, it confirmed that we made the right choice for Officer of the Year. You were very eloquent, and your understanding and your effort that you made, I think, goes above and beyond what you're required, but is probably emblematic of you and others in your department that they care and to learn more. I think since we've been working with the CIT and with a number of departments, I think we're hopefully exchanging a lot of information and improving the system. Because at the end of the day, we're serving the same people. At that breakfast, one of the chiefs shared with me that 80% of their mental health calls are from the same families and the same residences within their community. So it's repeat and repeat, and what they're really doing is hoping we need to get them hooked up with us and the providers the right services. And I'm hopeful with the continued dialogue and action and on our part and with the law enforcement community, we can make that a little bit easier. I think there's been some improvements. We still got a ways to go, but I think we're getting there. And I want to thank you for being a leader in that and for stepping up. And I hope you hang on a couple more years. I come from a police family, and when my dad hit 25 years, he says, "I'm doing great. I'm going to hang on for as long as possible." And then about a year later, he says, "I put on my papers."
Yeah.
It's tough after that long. That's right.
But I will tell you, just to say one more thing, you guys are making progress. Because, I mean, I went to the first CIT training, law enforcement, I don't know how long ago it was. It was probably at least 10 years ago. And then I recently went about a year ago, and completely different. I mean, you guys are literally listening to feedback and wanting to hear what us on the road are experiencing on a daily basis, and wanting to hear that and wanting to take that information and make it better. So we appreciate that.
Good. Anyone else? Well, we want to thank you for coming.
You're very welcome.
And
thank
you very much for it.
Thank you.
And congratulations.
Thank you.
All right, the next item we have on the agenda is the chairperson's report. So just two items. One, last week I was invited by the chairman of the Legislative Committee, County Board of Commissioners, to come to their morning meeting. That's Chairperson Brendan Johnson, who, by the way, represents Rochester and Rochester Hills. And because we have two openings on the board, and they wanted to hear from us in terms of things that we were looking for. And I did say to them that whoever gets appointed has to fill some pretty big shoes of Melchiah Newman and Christina Root. That's on the record, and I meant it. And so, we said I think one of the positions is for persons being served, and then another one is general public. So we talked a little bit about that. I think I fairly represented that. Ultimately, that's a decision for the County Board of Commissioners. And they did get a number of applications, and I think they're interviewing 9 people. So there was a lot of interest in the two positions, and we hope we get someone. I did mention also that we're a busy board. We have 3 meetings a month. We have some committee work. So whoever wants to jump on board, they need to make the time commitment to be an effective board member. So after that, and that leads into my second part of my report. After that, our COO and Sheila were very kind to take me on a tour of the Resource and Crisis Center. And it was a real eye-opener. Because I hadn't been there before, but it's a pretty significant structure and building. I was impressed. I got to meet a number of our employees, and in checking with Dana today, we've hired 110 employees for the Crisis Center and related activities, and 80% of them are persons from Common Ground, who we welcome with open arms. So in terms of the continuum, it's happening because the people who were doing the work before are doing the work now. So that was wonderful to meet them. The folks who came over from Common Ground in particular were very enthusiastic about being with OCHN. They also, as Trish has told me, and I talked to a few folks, they're having ideas about how to improve things because they're the veterans who have been there, and I think they know what's worked and what needs to work better. So we're embracing that. This is, at the outset, this is the best opportunity to make change and to effectuate it. So, more on that to come. And also, there's going to be, as I was told, we got a grant to upgrade the physical plant and the building. So I'm going to suggest, and we can deal with it under other business later, but if you think about it, instead of having a study session next week, we would instead not have a meeting. We have to cancel our meeting. We would have a tour of the facility. And the reason I think we want to do it now is because once the changes take place and the building gets fully populated with persons that we serve, we can't go on a tour because of a number of regulations and things of that nature. So, think about that if that works into your schedule, because you're hopefully going to be able to make it to the meeting. But we would do it at 5 o'clock, and I think it would be about 45 minutes or so. Yeah. And then there won't be any meeting, there won't be any sit down or any action that the board's taken or anything else going on. But I think it was a real eye opener for me, and I've talked to a few of you, and I thought it would, kind of be a little bit different, off-site, not here. And it is, as you know, we've all made a major investment in resources and time into the crisis continuum. And so I think it'd be a good idea if we went and saw the physical plant. So I'll bring that up again for a motion under other business under number 7. And it was very instructive, like I said, tour, and understood a lot more about how important the services are, reinforced how important those services are, and how important it is that we have the veterans from Common Ground with us in this endeavor. And so I'll leave it at that. So that takes us to our regular board approval items. There are 4. And the first one now is our QAPIP and CERC report. We did have a presentation at the COW meeting, our committee of the whole, last week. And so we're not going to repeat that, but we did have a presentation, but we did have a recommendation from the committee for approval of the report, which I believe we are required under regulation to approve. So, do we have a motion?
So moved.
A motion? Is there any support?
Support.
Support? And we did have a good discussion and did learn an awful lot from that report and some things we need to do and change. And we look forward. I think we ask that we get an update in the near future on some of the things that following from that report of what we need to do to make some improvements with the provider network.
Maybe at the next meeting, not the next week, following the meeting,
right.
Maybe you come back with, here's some of the things that we looked at that we think we can do.
Right.
Versus waiting for it.
Right. Right. Absolutely. All right. There being no further discussion, roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles? Yes. Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Yes. Dr. Karanchuk? Yes. Ms. Root?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. And we do want to thank Marquita Massey, Adam Hamilton, and Dr. Posios, who did an excellent job in putting the report together and presenting it to us. And we look forward to their follow-up. Next, we had the needs assessment survey that Francis Carley brought before us. Again, we did have that presentation at this the COW meeting. We're not going to repeat that, but do we have a motion for acceptance of the needs assessment survey?
Support?
Motion and support. Is there any discussion? I know you've still got a few steps to go on that, right, before the survey's finalized.
So clarification, the survey, the finalized survey is in the board packet, so you
Right.
would be voting on the finalized survey.
That's right. I apologize. That's
Yep.
right. It is in the board packet. Thank you for that correction. There being no further discussion, roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Dr. Karanchuk?
Yes.
Ms. Root?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Next is the PCE contract, which is our IT hosting agreement, and we did ask Nasser Doss to come back tonight to give us a little bit more of an update and information regarding the contract.
Good evening, everyone. Nasser Doss, CIO. So as introduced in the last meeting, we want to extend the contract with PCE, which is the main information system for OCHN. We depend on that system on two different pieces. One is the administrative record, like eligibility, claims adjudication, recipient rights, grievance appeals, all of that. And the other one is as an EMR, electronic medical record. And we use it for the services provided by OCHN, the electronic medical record, as long as some of the providers, we extend the system to them to use it as EMR. In addition, the system is capable of doing something called HIE, Health Information Exchange, for the providers or with the providers who already have an EMR in place. With that being said, I'm open for any questions.
Yeah. Anybody have any questions for Nasser?
Because I talked to John about that. I know we didn't have the numbers last week, and I really felt, because it was a large amount, that we really did need to see the numbers. And the other, in relation to the other competition, and I think that Dr. Hahn brought that up as well, in relation to other systems versus what we were doing. What would be the savings or cost abundance if you change systems or what have you? So could you just go a little bit more into detail in relation to saying this is why this one's the better one for us, based on your experience and what you've been experiencing with this information system?
Absolutely.
Thank you.
So,
Thank you very much.
absolutely. So, number one is there's two different type of systems in general, okay? One is called CUTS, commercial off the shelf, like Microsoft Word, for example. Okay, I can buy it, you can buy it. It's the same piece of software. And the other one is a customized software. Odin or PCE actually in the business of customization. So they sell their systems to different clients, whether service providers or PIHPs, but each one has its own flavor. Having that being said, we, OCHN, have been with this vendor for the past 16 years, something like that. Throughout the years, we did a lot of customizations. So it's really a reflection of OCHN business processes. If we go through another system, we will need to redo all of these customizations again. One, two, we are not going to start from scratch. So the data migration from one system to the other is always a very risky business. For these reasons, we decided to extend the contract with the same vendor. In addition, in all honesty, it's like an extension to our IT staff here. So they never failed us. For example, when we moved from the service model to the fee-for-service, payment model, right? That was huge. They worked with us. We got it done. Currently, the crisis center, right? Parts of the crisis services were not there. So really quickly, we worked with the vendor to have the necessary modules and customizations there, and we're still working with them to make it even better. Things in this nature. So as I mentioned in the last meeting, moving systems that are mission critical, like Odin, is really a risky business unless the vendor is not up to our expectations. But this is not the case.
And I think that's a better explanation, and I appreciate that because it's important to know, and it's almost as if we're married to the system because they've been going along with us as we've made changes, as we've made development, and it's been a lot easier adding to, okay, instead of trying to start all over. Thank you very much.
Thank you. Any other questions?
Any other? I just wanted to add, or based on what you said last week and some follow-up, is what struck me as being very important is, number one, you've already said we have a customized system. This is not an off-the-shelf system.
Nope.
You can't, it's not like Microsoft, 5.0 or whatever, and you just go buy it and install it on your laptop. Highly customized system because the rules have changed and the reporting requirements have changed, and we've had to customize it over the years. So if somebody else new came in, that meant that we would have to, in essence, teach them how to customize our system because they hadn't done that before. So that concerns me because that takes a lot of staff time, and this is our primary compliance regulatory system. And we have reports that we have to submit in a timely manner to the state and the feds in order to keep the wheels moving here and also for transparency's sake. So I think that's also very important. And one thing that really struck me, you talked about last week, was that we have a number of major providers who interface with the system, and this is the system they're used to, and if we change systems, they would have to retrain their people in order to deal with a new system, which, I guess if it's not broke, why do we want to fix it? But I understand, and I appreciate the concern about wanting to go out to competitive bid, but after looking at this a little more, PCE has 95% of the market, is what we know. And so we are with the best. You said you're very satisfied with their performance. They gave us, I think, a very reasonable increase request. I think it was around 7%, which is shockingly, I don't want to say it's low, I just say it's reasonable. But based on what I know in the IT world, a lot of the increases that people are seeing are much greater. So I think for all those reasons, I would like to see us continue with this vendor under the contract.
If I may, I want to add one more. You reminded me, Mr. Cohen, they have a very good relationship with the state because it's three-way process. The provider, the PIHP, then we submit to the state different reports. So they attend regularly when there is a big change at the state level, right? We don't need, they take the heavy lift from us in this. Actually, they even negotiate with the state, no, this is not the right way to do that. We need to do it the other way.
Right. Okay. Any further discussion? All right. Yes, Dr. Jones. Yes.
Hi, I'm sorry, it's not a question, it's a comment. I do want to say, I think when we look at the cost for the system does not include the cost to recustomize another system. I work for a provider and we're moving away, and the hours spent customizing the system, the meetings, the amount of time is not included in this cost. So I would agree and support the decision to stick with PCE. And as a side note, I've been working with PCE since I was in training in like 2004, I think, or 2005. So PCE, I've seen the progression and the customization between different providers that I've worked with. So I would support that because it's a lot of hours and time and money spent that's not in the bottom line cost. So
Thank you. In addition to the OCHN staff knowledge, so we have staff who have been trained and subject matter experts in the system. To create that again, it's a lot of work.
All right, any other questions?
Yeah,
Comments?
my concern is only this, that technology, as we know, is expanding by, it's very difficult to keep up with. The system was started more than 10 years ago, at least. I was maybe 12 years now. So I'm sure, and we were probably the first one to go on this in the state or probably even in the region. I could be wrong on that. But I think the decision should be informed and what else is available and what are they lacking that this is something that meets our need to a T. So that is my concern, because at the end of the day, it's still a large amount of money. It's a big contract, at least one of the bigger ones that we have here. So that is the reason I think for our information, people like me who are not tech savvy, it would be a good thing to learn about what else is available, because even my own field, every year, things are changing. Now, one of the concerns in my specialty, which is radiology, is that when they are training the residents in the specialty, they are using AI to make diagnosis instead of using their own thinking or their own diagnostic skills to do that. So I think that was my reason for main reason for that. At least we should explore what else is available, or is it countrywide? Is it how many states are using this system? I think that would be a good thing to know for us. At least we will be better informed before we make a decision.
Sure. So is the recommendation is to go through an RFP, for example?
No, we'll see what the motion is. I think we could have a motion for that, or we could have a motion to just approve the contract.
Okay.
Okay, so that's what, we're going to discuss that here in
So
a
I'm
second.
going to thaw the baby in half here. I'm comfortable that they are the best right now, but I've heard what you said at 2 meetings. In 5 years out from now, I think somewhere in the middle of this, we need an RFI. The basic request for information, which is what Dr. Hans is getting at. Technology is moving, AI is moving at a scary pace, and I say scary because we've tested it, and you get one error in it, and all of a sudden you've got a major problem. So, and the contract already ended in December, which makes me a little uncomfortable. So I'm comfortable making the motion that we go forward with this. We have a 90-day out clause. I don't see them in our finance folks. So I'll look at Trish, right? 90-day out clause on this? I seem to remember that.
Yes,
90 days what?
90 days out.
90-day out.
The contract actually ended the end of December, and we are
Right, so technically we have no contract right now, which I'm
on a monthly basis.
not real happy with that.
Contracts differ, they're not always 90, but between 60 and 120. Solano, correct me if I'm wrong, but.
For an out?
Yeah.
Okay. So I'm comfortable making a motion to go forward. I think we need an RFI somewhere in year 2 or year 3 to see where technology has evolved. And part of the reason I'm comfortable making the motion is, we can unwind it if we find there's something that's better out there in the RFI process.
Sure thing.
And in looking at what the implications would be with the other systems that we're connected with, as Dr. Gauss has just said, as well. So it's not just an impact on us, it's an impact on the other persons or the businesses that connect with us. The program changes. So I do think that, looking at that after making sure that we're aware of our 90-day out clause. That's important, but I also think that we have to look at the system has been built and is continuing to be built on our need as well. So that's the thing. And now I have the right numbers in front of me, so thank you.
Thank you.
Did you make a motion?
Yeah, I'll move to accept the contract with the amendment of we do an RFI sometime between year 2 and year 3.
And I'll support it.
Okay. Motion and support. Any further discussion? There being none, we'll have a roll call vote, please.
Okay, so to clarify the motion, you're accepting the contract as presented, but would like an RFI in the next 2 to 3 years.
Correct.
Okay.
Yep.
Ms. Root? Yes. Dr. Karanchuk?
Yes.
Dr. Hans? Yes. Ms. Woodruff?
Yes.
Dr. Guadalupe? Yes. Pastor Jones?
Yes.
Dr. Giles? Yes. Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Thank
Thank
you
you.
for your
Thank you.
double presentations.
Good job. Thank
Yeah, now just make sure it works. All right, next we have our last item of approval is the PIHP contract amendment, which Kalan Ali, our legal counsel, presented at the COW meeting. It is non-monetary changes to provisions in the contract. Do we have a motion?
Move for acceptance.
A motion
Support.
for support and support. Is there any discussion? A roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff? Dr. Hans? Dr. Karanchuk?
Yes.
Ms. Root?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. All right, next is just to receive and file. That was our December financial reports, which was the end of our first quarter. That was presented last week by Richard Carpenter. So we're starting to see some light at the end of the tunnel, and we hope that trend continues. And we'll just receive and file. No vote is necessary. Next, we have the consent agenda for a number of board and committee minutes for the month of January.
Move for approval.
Support.
A motion and support. Is there any discussion, any suggested modification to any of the minutes? There being none, all in favor say aye.
Aye.
All opposed, the motion carries. All right. So that brings us to other business. I did, first of all, are there any items of other business to bring before the board this evening? Okay, so if we can revert back to I thought about the meeting on the 26th, the study session. If the board was interested in taking the tour, we would need a motion to cancel the study session as scheduled, but that a tour, not a meeting, would take place at 5 o'clock on the 26th at the Crisis and Resource Center.
So moved.
A motion, is there any support?
Support.
And I'm sure if for some reason circumstances arise that folks can't make it, that through Trish or whomever and Dana, you could arrange a separate tour. But, okay, is there any discussion? Is that everybody think that's a good idea? I know a couple folks told me they weren't going to be here, but I think the majority of the group's going to be here, so. Okay. All those in favor of the motion say aye.
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 All those opposed? All right, the motion carries, so Sheila, you got that all down? So you'll post the cancellation. I think we still have to post the tour, but make it clear that it's not going to be a meeting. There's really no place to hold a meeting there. If we did, there's maybe one conference room everybody could jam into, but we're not doing any presentations or anything. It's just going to be a tour by folks who are there, and I'm sure you'll have a chance to meet some of the people who are working there also. So.
Just the board executive committee, are we going to hold that?
No, we can do, let's not.
Okay.
Let's just
We'll
do
email
the,
agendas.
let's
Okay.
just do the, get us the agendas to the executive committee, and we can figure out a way to get that done for March meetings. Okay. All right. Next board reports, the Recipient Rights Advisory Committee, Dr. Guadalupe.
Yep, so the approved minutes from the January 8th meeting included the topics for that meeting were the fiscal year rights annual report was reviewed, a list of topic areas for discussion in fiscal year 26 RRAC meeting were developed, discussion regarding presentations of materials for the committee to make sure everyone felt that they were getting the materials in the way that they wanted to, and the agendas were being developed well. The committee did share that they were appreciative for Dana's director's reports, which are now being provided on a monthly basis, and we're thankful for Dana coming to as many meetings as she can to provide updates during our meetings. We reviewed member term limits. At that time, there's still 2 vacancies on the committee. And then we always receive an update on the site visit report. So our next meeting is March 5th, here in just a couple weeks. Thank you.
Thank you. The Citizens Advisory Committee, Ms. Root.
Okay. Our February meeting is scheduled for tomorrow morning at 9:30 a.m. The link is available on our OCHN website if anyone would like to tune in. And then our January meeting was on the 21st. I do not have any major updates to share from that meeting, but I did want to let you know that I informed the CAC that my board position is ending in March, so they would be getting a new board liaison for the group. And I would like to ask, do we know when you will vote on which board member will be the new CAC liaison, in case they ask me tomorrow?
No, well, it'll be the Board of Commissioners that'll be voting?
No.
I'm sorry.
Yeah,
Oh,
for
these
the
members.
CAC, yeah.
Oh,
So we
I'm
need to
sorry,
ask.
I'm sorry.
So next month will be my last meeting with them,
Yes.
so we would need a new board member to be
Yes.
the liaison for the April meeting.
Yes, thank you, I'm sorry,
Yeah.
yeah. Sheila, you got
March
that? Make
board
sure we
meeting.
get that on the agenda for the March board meeting. We need to appoint someone to replace Christina, okay? Which will be hard to do, but we'll
I know.
manage.
Okay, thank you, that's all.
Okay, thank you.
Mr. Cowan, typically, we probably wouldn't do that till April, because the new board members won't start serving till April 1st.
Okay, all right, that's a good point, yes, okay.
Okay.
All right. Right. Although, yeah, it probably wouldn't be somebody brand new. We could do it in March. I think, why don't we put it on the agenda and we'll see who we have for volunteers, and then we'll figure out if we have to impress somebody into duty. Impress, that's an old naval term.
Yeah, it's just typical practices, that's how we did it.
Okay,
Like
all right,
when
we're
the
gonna
new-
change the practice a little
Okay.
bit this time, okay? All right, thanks. Christina wants to know who's gonna replace her, so that's more important. I think it's important too. Okay, SUD Oversight Policy Board, Yvette Woodruff.
Okay. My report is usually a little longer than theirs because this committee meets quarterly, not monthly. And actually, we had a quorum. We met on Wednesday, January 28th. And there was no public comment. I was up first on the agenda in terms of what's been going on in the COW meeting for the past quarter. I talked about the fact that Alan Bolter had come in and provided an update back in November. And at that time, we talked about the anticipated contracts, that the bid would probably be issued around February 24th, and we were still in a holding pattern. And talked about the Chief Clinical Officer, Kim Flowers, and the Crisis Director, Kalia Ascent, had presented an update to the board on the crisis services. The Chief Operating Officer, Trish Jambua, reported on key organizational accomplishments over the past year. The standardization of race was one of the biggies, implementation of the fee-for-services, and expansion of the co-responder programs. Talked about the financial, the contracts that exceeded $100,000 that went before the committee of a whole. We also talked about the moment of silence that was observed in honor of Micaiah Newman, who had served on the board for 19 years faithfully in recognition of her passing. And up under community outreach updates, Director of Communications Suzette Warner talked about the Law Enforcement Appreciation Breakfast that was held on the 12th and who was honored at that breakfast, and that the Substance Use Community Workshop that was held on the 8th of January. The board asked if they could be put on the distribution list so that they could get involved in some of the things that were happening. Legislative update was provided by Ms. Carley, the Deputy Chief of Strategic Initiatives and Legislative Affairs. She provided an update about the RFP at the time, and she also talked about the judge's ruling back in January and how OCHN was scheduled to be part of the metro region along with Wayne and Macomb counties. All of this occurred on the 28th before the 30th. She talked about the framework and, how we were in a holding pattern waiting to see what was going to happen next. They talked about the legislative breakfast that's to be held in April. Our CEO, Dana, and our COO, Trish, provided an update regarding the crisis service transition. There has been a breakdown in the communications. It appears as though the transition will occur sooner than the April date that we were previously given. Talked about the fact that there would be no gaps in services, that we would continue to honor our contractual obligations to the state of Michigan to make sure that persons served were provided with necessary services. Talked about the current adult, talked about the fact that Common Ground had given notice that they would no longer provide services after 2/13. And Dana kind of went over the timeline of when negotiations first started and how the phases were supposed to occur. Under financial, Mr. Carpenter provided a financial overview and talked about how the PA2 funds were going to be used to help with some of the deficits in the areas of Medicaid and Block Grant. And some questions were asked about whether there were going to be any budget cuts, and Dana explained no. Really, it was to improve the continuum of care. Some folks wanted to know what front house meant and those types of things, and all of that was broken down. The SUD director, Ms. Phillips, provided an overview of what's going on that side. She talked about ASAM 4 rollout training for the providers. The prevention update was provided for the quarter in terms of the SINAR update, where different vendors were visited. They talked about the education that's given to vendors, the use of underage inspectors going out, and how our region, which is Region 8, scored a 82.5, and you needed at least an 80%, so we passed, yay. And just talked about some of the ongoing auditing. And let's see, there's an open board position, and if people are interested, they're really looking for someone from the faith-based community or recipient of services to serve on the board. And Trish also talked about the training plan that was supposed to have been completed by January, but an extension has been given until the next OPB meeting. And we approved the minutes from October, and we thanked the department for giving swag bags to all of the board members. They were very nice swag bags. And we adjourned at 2:56.
Thank you.
Hopefully that wasn't too long.
Thank you for all three of those reports. That brings us to the next opportunity for public comment. Again, same rules are kind of in effect to state your name and organization if you so wish, and also please limit your comments to 3 minutes in addressing the board. Do we have anyone online?
If you are online and wish to speak for public comment, please raise your hand at this time.
And then is there anyone else in the audience who wishes to address the board? There being no one, either online or present, here in the meeting room, we will close the second opportunity for public comment. And we're competing with figure skating in the Olympics tonight, so I think we lost that battle in our ratings. So, all right, now that brings us to our director's report. Dana?
Good evening, Dana Lassenby, CEO. First, before I even get into my report, I really want to take this opportunity to thank our team. I know it's been a huge 2026 already in terms of the transition of the crisis services and all the hard work and dedication that people have put into making this happen, even in a short order. So again, I want to make sure we thank every single person that helped with this transition, and then welcome the new team members who have joined us from Common Ground or also new people to the organization. So we want to welcome them and thank them for their dedication and commitment to continue to support crisis services. With that, I do want to acknowledge it is Black History Month, so I know we have an activity or event scheduled, and I was waiting for Suzanne to give us the details, but I'm sure we will be sharing that information very soon with some of the things that are coming up to support that. On a side note, and really not a side note, but in addition to, it's really suiting that I received a call from Mr. Kevin Fisher, the president and CEO of NAMI, Michigan, who wanted to make sure that we knew and that we were involved in the recognition of Ms. Malkaya Newman at the Honors Awards that will be in April of this year. I don't have the exact date in front of me, but I would make sure that you all have the information and that we can show our support by attending and recognizing the contribution that Ms. Newman made as on a personal and professional level in which she did for this community. So I just want to make sure we acknowledge that and we support that event. So also, getting into some of the meat of the report, thank you, Ms. Woodruff, for your report. You covered some of my stuff, yay. So what I do want to talk about very seriously is the transition of crisis services and how we are committed and working on some of the details. So you'll probably hear things or see things in the community, done a lot of interviews. I see a reporter in the audience tonight, done a lot of interviews. And really the main focus for us is to make sure people know that crisis services continue at the same location at the Resource and Crisis Center in Pontiac on the campus of the county exec. I think if anything, we don't want to create a sense of fear for people, and we want to make sure that they know that those crisis services are available. And we continue, our focus has really been on stabilizing and strengthening those crisis services following the provider's transition, right? But also protecting access to those services and making sure that we are providing those services and making improvements as we go along. So with the abrupt leaving of that vendor, we had to pivot very, very quickly, and we had some contingency plans in place. And also, we had some redirections that we were doing with the law enforcement community, and we want to change that as quickly as possible because we do have our law enforcement officers going to area hospital EDs. In some cases, that is the quickest place for people to be served, but also we are still accepting walk-ins, and if law enforcement brings them to the RCC, we will continue to support and provide those clinical assessments that they need, assist with transition, and making sure that people get what they need. The goal is, next very big goal, is to reopen the Crisis Stabilization Service area, which we know as OASIS. Again, we have hired over 110 people, and 80% of those individuals are from the previous vendor. And so we have completed training. We're in the process of making sure people are in place. And we want to do it in a safe manner in which we are looking at those opportunities to improve our process, but also making sure that within the next few weeks, if not sooner, because we're working on sooner rather than later, we will at least open 2 of those crisis stabilization beds. So our teams are really working together. I appreciate all of the other OCHN staff who've taken an opportunity to go over and support and welcome the new members of our team, but also to learn more about what goes on and how we can better improve those services. So the volume is still there in terms of it's not as much as it was previously, but we do have individuals that we're serving. We do have individuals who are being assessed and redirected to the appropriate services, be it inpatient care, also outpatient providers, partial day hospital providers, and we're also closely working with our area hospitals to make sure that they are able and ready to receive anyone who comes their way. Our hospital liaisons are still available and helping out in terms of transitioning and making sure that we're available to assist in any of those individuals who are in the hospital EDs. So we're looking at the data. We're looking at it every single day and making sure that some of the things that we're hearing is that the hospital EDs are backlogged with people in crisis because of the law enforcement officer drop-offs. But honestly, when we look at the data, it doesn't support those claims, and we're working with our hospital partners to ensure that we communicate with them and let them know that we're here, we're open, we're available, and that we will work through any of those challenges that may exist. Also working with Pontiac General Hospital, I'll say, in our area hospitals that are close to the RCC has been beneficial. We're working out some final details with some of those hospitals to see how we can work together to have direct admissions so we don't have people waiting for those services and supports that they need, to do some of that crisis stabilization in the community. Some of the benefits really have been our ability to partner with pharmacy, to have on-site pharmacy at the RCC, and other improvements as Mr. Cohen spoke to. So the RCC, again, remains open. We also have our sober support unit, and I think if we know Megan, our director of SUD, the very next day she was back in, had everything going, actually doing assessments herself if she needed to. So again, that's really the theme I see with our team, is that everybody is jumping in, all hands on deck, and people are making sure the services continue. So again, we filled over 100 positions. We continue to recruit for more of our clinical team members and nurses. So if you know people, we're happy to interview and take applications. We have actually completed 272 screenings since we started. 234 unique individuals have been served. 124 sober support admissions have occurred. So a majority of the people that we have assessed have resulted into inpatient psychiatric hospitalization, and still working with our law enforcement community. And one of the things about our crisis residential unit, which is where people can stay 5 to 7 days or up to 12, right, Trish? That's what she always tells me. is actually one of the areas that we're waiting for the state in the licensing. So we're in the midst of getting that done. And in fact, I spoke with the director of the Health and Human Service Department over behavioral health, and she offered her support. Kristen Morningstar offered her support in terms of if there was anything we could do to expedite the process of getting our licensing as well as reopening our crisis stabilization unit. So it's good to have that level of support so we can get things moving faster. The other things I wanted to talk about have to do with our access points, and I have that information in my report. But I also want to address one of the questions that came up and one of the things that we are working on, and that is direct care management services. I know we've been asked several times if we are going to provide direct case management services, and the answer is yes. And the reason being is that we've been talking about this for quite some time, because we also have to make sure that we have the capacity to serve, that people aren't waiting for services. And sometimes the language we use causes a bit of confusion. We're not taking in case management services. We need all of our providers out there that are providing those services to continue to provide our services. And they're doing so much of that, some of them aren't able to take on new individuals who need that level of support. So we want to make sure that there's no gaps, there's no extended wait times, and we're working with our providers that we currently have, and we're also opening our network so that we can have more providers and more choice. We have former board member who talked about having a desert in the northern part of the county. Right, northern part of the county, getting my directions, right? And so we do see that there is a need for more service availability in the northern part of the county. And what does that look like? Does it look more mobile? Does it look like we have facilities or places for people to go? So we're open our network to make sure that we're filling in any gaps and covering services and supports. People have choice and there's no wait period. We have a couple of our larger providers that have self-imposed referral moratoriums, meaning at this point in time they really can't take on new individuals to be served. And again, we don't want people waiting, but also we want to make sure the quality is there. So when you have a large volume of people for one case manager or one supports coordinator, it impacts quality of care. So we want to make sure that we're supporting that process and that people get what they need, even in the event that when our providers open their doors back up or their referrals reopen, those individuals, if they choose to, can choose to go to one of those providers. So it's not our intent to take anything away, the business away from our partners and our providers. It really is to work and make sure that we have no gaps. So we know that over the last year, a lot of changes have occurred. So we really want to make sure that we're working with our providers very closely and also keeping the lines of communication open and transparency. So had a few meetings this week with our two CCBHCs, CNF Healthcare and Easter Seals Mort, along with CMHA, Bob and Alan Bolter, just to make sure that we're working together as we transition and they grow as CCBHCs. We want to support those efforts, but also understand how do we work well together. And so that was a very positive meeting. It was good to have an open dialogue. We also are responding to probably one of the memos that you saw related to the minimum wage increase across the state. And we received a letter from MALA and our Oakland Provider Alliance. And with that, we responded and also had a meeting. Our CFO, Richard Carpenter, and Trish and others met with that group of providers and made a commitment to really work together to make sure that the funds that we receive to add to the minimum wage increase, those funds are actually distributed in a way that makes sure that the right people are getting those increases and they're meeting the minimum wage requirement, which is now $17.13, I believe. So again, ongoing commitment, rebuilding the communication and the relationships with our providers, because we know there have been some tough changes along the way, but as the state funds us, and we're all advocating for the appropriate funding for those direct care professionals through that minimum wage. We're going to do this together. We want to join together with our providers and our advocacy efforts to the state to make sure that when we have these programs and services roll out that include the funding, that the appropriate funding is given so that we can pass it along to the workforce, so they can recruit and retain people who serve the people we serve, right? And let me think, what else do I want to cover here? So we do have an open network application at this point in time, our RFP, open for new providers. Still meeting with legislators regularly. Let's see what else. Oh, very, very good news. I want you all to join me in recognizing Miss Linda Bartoloni-Teal. She is the ARC Oakland County Lifetime Achievement Award winner this year. So we're excited for her. I don't think there could be anybody more deserving of this recognition than Miss Linda. She is always, I don't even know how she does it. I may send something thinking she's going to respond in a couple of days or Monday, and she responds right away. I'm like, are you asleep? You should be sleeping. So I probably shouldn't send it that late, but still. And then the other honoree is Mr. Adam Furman. He is receiving the Inspiration Award. So congratulations, Mr. Furman. Again, you two are the perfect people to honor in this event. And it will be, when is it? Next month? March 8th. And so a couple of us plan to get a table. And so let us know if you all are interested in celebrating our honorees. So with that, I will stop. I think I covered a lot. I had a hard act to follow with Ms. Woodruff, so I hope I answered some of the questions and concerns that you're hearing. And then also, we're responding to communication as needed, and just really wanting to make sure that, first and foremost, we let people know that the crisis services are available. It's not perfect. It's not the way we wanted to have this transition, but we continue to work and make sure that we're doing the things we need to do to keep people served.
Okay, does anybody have any questions for Dana? Just a couple quick things. Mm-hmm. First, thank you for the update on the minimum wage. The more I heard about this, it's very complex. Mm-hmm. I think the important thing is we're working with the providers. They have to initiate it because they're the ones who pay but we, I think we got $2.3 million to support that.
We had two reimbursements. One is for 2025, and Richard gave us the exact amount, 2.3, and the other is for 2026.
So we will distribute that money as long as it lasts, but the important thing too, I think, is Richard mentioned in a correspondence I saw that it would be retro to January 1. So if they've been paying this, they're going to get the money. So I think, and I understand, having seen some of the information, why it was a little confusing even to the providers. So I think we sorted through most of that now.
We're working through it, yes.
Right. We didn't get the information we wanted from the state, and that was one of the reasons where things were moving a little slower. But if we continue on that path and get the money to the people, we support the increase that they get, and if we have the money, we're going to fund it and move forward.
Absolutely.
Okay.
That's our commitment.
Okay.
The
one other thing I want to mention, because we've had so much going on, is the governor did put forward a proposed budget, which I believe, on what I read, seemed to be favorable to mental health concerns and funding. So if we could get Ben or whoever you think is the right person to sort through this and maybe give us a bullet point, maybe 2-page memorandum. Okay. And I would like to see if that's what the governor is proposing, and it is in fact favorable, we ought to think about getting behind it, and with the providers, telling our state legislators we need this funding. And I know they're dealing with a lot of issues because there's cuts in Medicaid that they have to make up so that people get their Medicaid And I understand that, and I applaud that and support it also. But we know the needs, we know what the needs are, we know they're not all being met, and if this gets us a little step closer, then we ought to think about perhaps joining with our providers, because ultimately it benefits them, because we're pretty much a pass-through organization. So I think we ought to think about that. But if Ben could get us something kind of muddle through, especially what affects us and our providers
Yes.
in here in Oakland County.
And I actually have a meeting with him and one of the legislators tomorrow who's one of the appropriations committee members. So hopefully we can, continue to advocate for that, because we know in a lot of the meetings I'm having recently is the demand is increasing. It's not going away, it's not reducing. More people are in need, and we need to be able to serve those individuals. And I think that is also why we're looking at how do we fill in any gaps or support our providers by, working with them to address some of the needs that we see coming to our door. We don't want to turn anyone away, and that really is the model of care when we are fully operational for the crisis center and other areas in the community. We will not be turning anyone away.
I think that's very important to know. Any other questions for Dana? Okay, before we get to board member comments, I'm going to deviate, and we have a small presentation, and I'll take the blame for doing it now. So this is to our distinguished OCHN board member whose term ends on March 17th, 2026. I might add that St. Patrick's Day, very significant day. And this is for you, Christina. You have been a distinguished board member. You have given your all over the last 3 years. All of us have had agreements and disagreements, but at the end of the day, we know where your heart is. It's with the people that you serve. You've given us a unique perspective as a practitioner, which I think is very important, along with your other clinician colleagues here, to understand what happens at the street level, so to speak, because that's who you're dealing with and supporting. And we have appreciated your enthusiasm. You've showed up, you've worked, you've been involved in the committee, as you pointed out today, and you're still concerned even though you're leaving. So I know you told me maybe one day you could come back. I would urge you to think about that at some point when it's good for you. But at this time, if you would meet me in the front and the entire board, and we'll take a great picture with you, and thank you for your service. Another award winner here. I'm sorry I'm going to miss that. All right, we got everybody? Or you need to close ranks a little bit? Okay, thank you. Here, we're going to give it to you. Okay, all right. That stuff all fits in. Okay, Christina just asked me if she gets rebuttal time, and of course she does. So we're going to offer you the first opportunity for board member comments. So go ahead.
Well, I didn't prepare anything official, but I just wanted to say thank you to everyone in this room, everyone online. It's been 5 years, actually. November 2020.
Oh, my goodness, you're right.
Yeah,
I apologize.
was my first. That's okay. So we were online. We were all virtual. We were in the pandemic, the thick of it. Yeah, I just thank everyone for giving me a chance, giving me a voice. I think that we do amazing work in a system that's very complicated, and I appreciate how everyone here just keeps showing up. And yeah, I hope to see you all in the community, in different places. Maybe I could return in the future. I know we've had board members who have stepped away and have come back, so definitely keeping that in mind. But thank you so much. This is really beautiful, and I'll cherish it.
Thank you. Dr. Giles.
Well, I'd like to say thank you for all your service. It's been great to chat with you either before or after. Thanks for your support of the people we serve. Really appreciate that. I'd also like to forget the officer's name. Yes, I was looking for her last name, but Officer Amy Dramer, thank you for her service. And I'd like to thank all of the staff at OCHN for the work that you do that oftentimes we neglect to mention. So very appreciative for all the work. I think that's it. Thank you.
Pastor Jones.
Well, let me begin by saying congratulations. We're going to miss you and all of that. You know, people come and go, but friendships continue. And thank you for the friendship that we've gained while being on this board together. So really appreciate you and the comments and the interest and the commitment that you had. So I want to say congratulations to you. I also want to say to Mr. Doss, thank you very much for the information that you gave tonight and the report. I think that was very, very important for the total group to hear. So I really appreciate what you did. And Adam, my buddy, congratulations on your award, and I appreciate what you're doing. And so, you know, I guess, boy, this is just a great night. It's a great night to celebrate each one of you. So thanks a lot, and to everybody, good night.
Well, you're coming back next month, right? Yeah. So thanks for your service, your dedication. I'll give you a more formal send-off because you got to show up. Linda, thank you for everything you've done, including some of my frantic phone calls a year ago when, we'll just say, the state lost some paperwork for one of my guys, and you were able to miraculously find it, so I appreciate that. Adam, couldn't think of a better person to get that award, and look forward to attending next month to watch you receive it.
Adam, you're next.
I'd just like to thank the officer and congratulate the officer on her award and also her service. Her presentation tonight was very informative and inspiring. I'd like to thank or congratulate Linda for her award as well, and thank you very much for the encouragement tonight. Also like to thank Nasser for his presentation as well as Dana's update. And Christina, I know, like John said, hopefully you'll be here next month, but yeah, I just really enjoy your heart for the people that we serve, and I just wish you luck in your future endeavors. I'm sure all of those will be very worthwhile and beneficial to the community. So have a good night.
Dr. Hans?
Yeah. I wanted to congratulate Linda and Adam. Actually, I got the mail from Mark earlier this week, no, or late last week, and was very happy that our organization has such two dedicated people who are recognized in the community, and that also from disabilities population. So that is really, but I think these awards were well deserved, well earned, and should have come a long time ago, because your work is really very important. Also, I wanted to thank Christina for 5 years. I actually met her 3 years ago, or 4 years after the COVID happened. But yes, very quiet, very soft-spoken, but her comments are not very often, but they are always very profound, and I appreciate that. I've learned quite a few things from her. I wish I could be as calm under stress as she is, and raise her points in such a sweet way that you just can't equal that. I mean, I really appreciate that, and we have often talked about that. And also thanks to Nasser for putting up with my questions, and I know you are one of the best IT people we have had, actually, in the 15 years that I have been on board. So thank you for all your hard work, and thank you for always being ready with the answers. So thank you. Dana, I don't often thank you, but thank you for your leadership. You have, seen us through some very tumultuous times, and I appreciate you. Thank you.
Jennifer?
Yes, Adam, congratulations. Christina, congratulations. And I know you're leaving as I'm coming in, so we have a month to get to know each other, and you can share all of your board wisdom. Also, just want to really thank Officer Amy as a therapist and someone who's worked with kids and teens in crisis for many years. It's always helpful when we have people in the schools or in other roles who are really partnering with us, and it just shows that all hands on deck are really needed for the mental health care of kids, teens, and adults. So grateful for her service and experience that she shared.
Yes. Yvette?
Yes. I'd like to start with the officer, Amy Dramer, her story, her viewpoint. It was great to hear because it was, we often hear the viewpoint of the family, we often hear the viewpoint of the providers and as overseers, but she had a viewpoint from a different lens, and that was great that she was able to share her story. So she was very deserving of her award. Also want to thank Linda and Adam for their reward, the award that they're going to receive from the ARC, and congratulations to Christina for her 5 years of service, and hopefully your upcoming endeavors will be great. You'll go on to do great things. And a big, huge thank you to the staff, because sometimes when a ball gets bounced into your lap, you may fumble it, but it seems like you guys have crossed the goal, some of the goal lines, so continue to carry that ball and realize that you have cheerleaders rooting on the side. And that's my comments for tonight. Is that long enough, Dr. Giles?
All right, I'll kind of wrap it up tonight, but first to the award winners, congratulations, very deserving. It struck me in when I went to the meeting last week with the Oakland County, that with your 5 years of service, Christina, and Malkiah's 19, that's 24 years of service we're losing from the board, but you've made an impact. And I think, Christina, you need to know, we always say we are the voice, and you have been the voice for those who may not always have a voice. And that's what it is all about, being a board member here. And I've seen some turnover in the board. This is a big turnover, but I think it calls upon all of us who are here to redouble our efforts and to welcome the new board members, which I know we will do and have done, and still work together for the common purpose we are all united by. I do want to mention one thing. I did hear earlier tonight, one of the speakers said that we got engaged in the crisis services and, in essence, to manage that because of an RFP. Well, I'm sorry. Nothing could be further from the truth. That transition occurred because we felt every person who was in crisis needed to be served. And it wasn't going to be selected who got served and who didn't. And number two, that we want to build the best crisis management system and service system in the state of Michigan. And I know this has been a rocky road. I've been involved in a lot of things in my career and lifetime, and this was ranked right up there with some of the difficulties in the transition. But it underscores the depth of the people we have here. Because I looked, and in the first week, 115 people were served the first week. 72 additional individuals were served in the sober support unit, and we did manage the new crisis line, and we're getting calls. So the services are occurring, even though it didn't happen the way we all wished, a more smooth transition. But quite frankly, that's old news. We have it now, and we are going to continue to move forward, and I look forward, and I want to thank the entire organization, all the employees, because I know a lot of you got asked to maybe cover or help. Maybe you weren't directly involved, but everybody had to pull together to make this work. And the beneficiaries are the people who are in crisis. We may never hear from them. We may never get a thank you. It doesn't matter. We know we're here because we have a job to do. And I want to thank you all for doing that job in supporting this organization. So you have a lot to be proud of with all the people who are here. And I was really enthusiastic and got a shot of adrenaline from going that day for that tour and seeing just how good people feel about the change and what they think they'll be able to accomplish for the good of the citizens of Oakland County. So, with that being said, if there's no other business before the board, we stand adjourned.